My name is Dr. Michael Chen, and I've been an anesthesiologist for 12 years here in Chicago. I've guided thousands of patients into the peaceful darkness of anesthesia and brought them safely back to consciousness. It's a responsibility that demands absolute precision, unwavering focus, and complete trust in science. Every calculation, every drug, every decision follows protocols built on decades of research and evidence. I thought I had seen it all. The routine surgeries, the emergency cases, the delicate procedures where millimeters and milliseconds make the difference between life and death. I had built what I believed was an unshakable foundation of medical knowledge around me. Logic was my armor, science was my sword, and experience was my shield. But on that Tuesday morning in March, at exactly 7 hours, everything I thought I knew about medicine, about life itself, began to crumble. The patient's name was Robert Martinez, a 52-year-old construction worker from the South Side. He had been living with a dangerous heart condition for 3 years, a weakened left ventricle that made his heart pump blood like a car engine running on half its cylinders. His cardiologist had finally recommended surgery, a complex procedure to repair damaged heart tissue and restore proper blood flow. When I first met Robert the night before his surgery, he was sitting on his hospital bed, nervously fidgeting with his wedding ring. His wife Maria sat beside him, her hand never leaving his. Their 2 teenage daughters stood awkwardly by the window, trying to mask their fear with forced smiles. "Doc, I ain't gonna lie," Robert said, his voice carrying the weight of a man who had worked with his hands his entire life. "I'm scared. Maria here keeps telling me everything's gonna be fine, but—" He looked at his wife, then back at me. "I just need to know I'm gonna wake up to see my girls graduate." Maria's eyes were already red from crying. She squeezed his hand tighter and whispered, "You will, mi amor. You have to." I had given this same reassuring speech hundreds of times before. I explained the procedure, the anesthesia process, the monitoring systems we would use. I told them about our surgical team's experience, our success rates, the advanced technology at our disposal. Everything by the book. But as I looked into Robert's eyes that night, something felt different. Maybe it was the way he kept looking at his family, or the quiet desperation in Maria's voice when she asked me privately in the hallway, "Doctor, please, just bring him back to me." There was something about this case that made my usual confidence waver, even though I couldn't put my finger on why. The next morning arrived gray and cold, typical Chicago weather in March. I arrived at the hospital at 6 hours, my usual routine. Coffee first, then reviewing Robert's charts one more time. His heart function was concerning, but not the worst I had seen. The surgery was complex, but well within our capabilities. Everything looked manageable on paper. Before I continue, tell me in the comments which city and country you're watching from. Stories like this one reach farther than you imagine. At 8 hours sharp, we wheeled Robert into operating room 3. The familiar sounds of the OR surrounded us. The gentle hum of machines, the soft beeping of monitors, the quiet conversations between surgical team members preparing for the long procedure ahead. Robert looked up at me from the gurney, and I saw that same fear from the night before still lingering in his eyes. "Doc," he said softly, "if something goes wrong—" "Nothing's going wrong, Robert," I interrupted gently, placing my hand on his shoulder. "I'm going to take excellent care of you. When you wake up, Maria and your daughters will be right there waiting." He nodded slowly, took a deep breath, and closed his eyes. Dr. James Harrison, our head cardiac surgeon, entered the room with his usual confident stride. We had worked together for 8 years, and I trusted him completely. He reviewed the surgical plan one more time with the team while I began preparing my anesthesia equipment. Everything was routine. Standard medications, proper dosages calculated precisely for Robert's weight and condition. I had performed this exact sequence of actions thousands of times. Insert the IV line, attach the monitors, begin the flow of medications that would gently carry Robert into unconsciousness. "Okay, Robert," I said softly. "You're going to feel a little sleepy now. Just relax and think about seeing your family when you wake up." The propofol entered his bloodstream, and within seconds, his eyes fluttered closed. His breathing became slow and steady. The monitors showed exactly what they should: heart rate stable at 68 beats per minute, blood pressure holding steady, oxygen saturation perfect at 98%. Dr. Harrison made his first incision at exactly 9 hours. The surgery began like clockwork. I monitored Robert's vital signs while maintaining the precise balance of medications needed to keep him unconscious and pain-free throughout the procedure. For the first 2 hours, everything proceeded exactly as planned. Dr. Harrison worked methodically, accessing the damaged heart tissue while I kept Robert in that perfect state of controlled unconsciousness. The monitors sang their familiar, reassuring rhythm. But then, at 11 hours and 15 minutes, something changed. The first alarm was subtle, just a slight irregularity in Robert's heart rhythm that caught my attention. I glanced at the monitor, expecting to see a minor blip that would correct itself in seconds. Instead, I watched the rhythm become more erratic. "Dr. Harrison," I called softly, not wanting to alarm the team unnecessarily. "We're seeing some arrhythmia here." He looked up from his work, hands still deep in Robert's chest cavity. "How bad?" I watched the monitor more closely. The irregular beats were becoming more frequent, more chaotic. Getting worse, heart rate jumping between 45 and 90. This wasn't completely unusual during cardiac surgery. The heart doesn't like being manipulated, and sometimes it protests. I reached for medication to stabilize the rhythm, a small dose of amiodarone that should bring everything back to normal. But as I pushed the medication through Robert's IV, something happened that I had never experienced in 12 years of practice. The monitor went completely flat. No heartbeat, no electrical activity, nothing. "We've lost him," I announced, my voice steady despite the adrenaline now coursing through my veins. No pulse, no rhythm. Dr. Harrison immediately began internal cardiac massage, his hands literally squeezing Robert's heart to try to restore circulation. "How long?" he asked. I looked at the clock. 30 seconds and counting. The room transformed from calm efficiency to controlled chaos. Nurses moved with practiced urgency, preparing emergency medications. The perfusionist managing the heart-lung machine adjusted settings to maintain blood flow to Robert's brain and organs. Everyone knew their role. "Epinephrine, 1 milligram," I called out, pushing the powerful medication that should shock Robert's heart back into action. Nothing. 2 minutes, I announced, watching the clock tick forward with agonizing precision. "Doctor." Harrison continued the internal massage, his face a mask of concentration. "Come on, Robert. Come back to us." Another dose of epinephrine. Still nothing. 3 minutes. I tried atropine next, then calcium chloride. Each medication that should have restarted his heart had no effect. The monitor remained stubbornly flat, that terrible straight line mocking every intervention we attempted. 4 minutes. The surgical team worked in perfect synchronization, each person focused entirely on bringing Robert back. But I could see the growing concern in their eyes. After 4 minutes without a heartbeat, brain damage becomes a serious risk. After 10 minutes, survival becomes increasingly unlikely. 5 minutes. Still no response. Dr. Harrison looked at me over Robert's open chest. We both knew what the textbook said. We both knew the statistics. But neither of us was ready to give up. "Defibrillation," he ordered. The internal paddles were charged and placed directly on Robert's heart. "Clear." The electrical shock coursed through his cardiac muscle, and for one hopeful second, we all held our breath. The monitor flickered, showed 2 weak beats, then went flat again. 6 minutes. I pushed more epinephrine, stronger doses now. Desperation was creeping into my clinical judgment, but I couldn't help it. Somewhere beyond these walls, Maria was probably pacing the waiting room, maybe getting coffee, maybe calling her daughters with updates about how well the surgery was going. She had no idea that her husband's heart had stopped beating. 7 minutes. Dr. Harrison was sweating now despite the cool temperature of the OR. His hands never stopped the rhythmic compression of Robert's heart, manually pushing blood through his body. "Talk to me, Michael. What else do we have?" I ran through every emergency protocol in my mind. We had tried everything, every medication, every intervention that medical science offered for this situation. The pharmacology was straightforward. Epinephrine to stimulate the heart, atropine to block inhibitory signals, calcium to strengthen contractions, We had done it all. 8 minutes. The silence in the room was broken only by the mechanical sounds of the heart-lung machine and the steady beeping of monitors tracking Robert's blood oxygen levels. His brain was still getting oxygen, but his heart remained completely still. 9 minutes. I found myself thinking about Maria's words from the night before. Just bring him back to me. How was I going to face her? How was I going to explain that despite all our knowledge, all our technology, all our experience, we had lost her husband on what should have been a routine procedure? 10 minutes. This was the critical threshold. 10 minutes of cardiac arrest. The point where even if we managed to restart his heart, Robert might never be the same man who had nervously fidgeted with his wedding ring the night. Dr. Harrison looked at me again. The question hung unspoken between us. How much longer? 11 minutes. I prepared another dose of epinephrine, though my hands were beginning to shake slightly. In all my years of practice, I had never lost a patient during what should have been a manageable surgery. Robert's heart condition was serious, but not hopeless. This shouldn't be happening. 12 minutes. The perfusionist spoke quietly. Blood pressure is dropping. We're losing perfusion pressure. Even the machines that were keeping Robert's body alive were beginning to struggle. His blood pressure, artificially maintained by the heart-lung bypass, was falling as his vascular system began to fail. 13 minutes. I looked around the room at the faces of my colleagues. We all knew what 13 minutes meant. We all knew the statistics, the research, the grim reality of prolonged cardiac arrest. But none of us wanted to be the first to say the words that would end our efforts. 14 minutes. Dr. Harrison's internal massage was becoming more aggressive, more desperate. His technique remained perfect, but I could see the strain in his shoulders, the growing futility in his movements. 15 minutes. And that's when I heard Maria's voice in my head again. Just bring him back to me. I reached for one more dose of epinephrine. One more attempt. The logical part of my brain knew it was pointless, but something deeper inside me refused to quit. Not yet. Not while Maria was still believing her husband would come home. 16 minutes. I pushed the medication through Robert's IV line and watched the monitor with the same intensity I had been watching for the past quarter hour. Nothing. The same flat line that had been haunting us since this nightmare began. Dr. Harrison looked at me with exhausted eyes. Michael. 17 minutes, I announced, my voice finally cracking slightly. And then, something impossible happened. The monitor suddenly erupted with the most beautiful sound I had ever heard in my life. A strong, steady, rhythmic beeping. Robert's heart had started beating again. Not the weak, irregular flutter we sometimes see after successful resuscitation. This was a powerful, coordinated rhythm at exactly 72 beats per minute, as if his heart had simply decided to resume its normal function. I stared at the screen in complete disbelief. The EKG tracing showed perfect electrical conduction, normal wave patterns, everything textbook perfect. His blood pressure immediately stabilized. His oxygen saturation climbed back to normal levels. What the hell just happened? Dr. Harrison whispered, his hands still positioned over Robert's heart, which was now beating strongly against his palms. I looked at the clock. 17 minutes and 38 seconds of complete cardiac arrest. By every medical standard I knew, this was impossible. Hearts don't just restart themselves after 17 minutes, especially not with perfect rhythm and full strength. I don't know, I stammered, my voice barely audible. My hands were shaking as I checked and rechecked every monitor, every reading, every parameter. Everything was not just normal. It was perfect. The surgical team stood frozen, staring at the monitors as if they might suddenly change back to that terrifying flat line. But the beeping continued, strong and steady, the most reassuring sound any of us had ever heard. His heart rate is 72, I announced, my voice still trembling. Blood pressure 120/80. Perfect sinus rhythm. Normal electrical conduction. Dr. Harrison slowly removed his hands from Robert's chest and stepped back. For a moment, he just stared at the beating heart before him. In 30 years of cardiac surgery, he said quietly, I have never seen anything like this. I reached for my phone to check the time again, to make sure I hadn't miscounted. 17 minutes and 41 seconds. That's how long Robert Martinez's heart had been completely still. No medical intervention had restarted it. No medication, no electrical shock, no procedure. It had simply begun beating again. The perfusionist was the first to voice what we were all thinking. What do we do now? Dr. Harrison took a deep breath and looked around the room. We finished the surgery. His heart is beating perfectly. We complete what we came here to do. But as he prepared to continue the procedure, I could see that everyone in that operating room had been fundamentally changed by what we had just witnessed. The confident professionalism we had carried into OR3 that morning had been replaced by something I couldn't quite name. Awe, maybe. Or humility. Dr. Harrison resumed his work with hands that moved more carefully, more reverently than before. The repair to Robert's damaged heart tissue proceeded flawlessly. It was as if Robert's heart, having just performed an impossible miracle, was now cooperating completely with our efforts to heal it. I maintained Robert's anesthesia, but I found myself watching the monitors with an intensity I had never experienced before. Every heartbeat felt precious, significant in a way that transcended medicine. I kept expecting the rhythm to falter again, but it never did. Strong, steady, perfect. The surgery concluded at 2 hours in the afternoon. 5 hours total, with 17 minutes of cardiac arrest that, according to everything I had learned in medical school, should have been impossible to survive. As we prepared to close Robert's chest, Dr. Harrison paused and looked at his handiwork. His heart tissue looks better than it did when we started, he said quietly. The areas that were damaged, they look healthier. I leaned over to see what he was talking about. He was right. The weakened heart muscle that had brought Robert to our operating table looked stronger, more vibrant. The color was better, the texture more normal. It was as if the 17 minutes of silence had somehow allowed his heart to heal itself. That's not medically possible, I whispered. Dr. Harrison met my eyes. Neither was what happened 17 minutes ago. As we wheeled Robert to recovery, his vital signs remained absolutely perfect. Heart rate steady, blood pressure normal, oxygen levels excellent. Everything indicated not just a successful surgery, but an impossibly successful one. I stayed with Robert during those first critical hours in the recovery room. Standard protocol required careful monitoring as patients emerged from anesthesia. But this was different. I needed to see him wake up. I needed to witness the completion of whatever miracle had begun in OR3. At 4 hours in the afternoon, Robert's eyes began to flutter open. I leaned closer, watching for any signs of neurological damage from the prolonged cardiac arrest. After 17 minutes without a heartbeat, even if brain death was avoided, some cognitive impairment would be expected. "Robert," I said softly, "can you hear me?" His eyes focused on my face with perfect clarity. "Doc?" His voice was hoarse from the breathing tube, but strong. "How did it go?" I felt tears forming in my eyes. Not only was Robert neurologically intact, but he seemed completely normal. Better than normal, even. There was a calmness in his expression, a peace that hadn't been there before surgery. "The surgery went very well, Robert. How do you feel?" He considered the question carefully, as if taking inventory of his entire body. "I feel different. Good. Different. Like something that was broken inside me got fixed. Really fixed." Over the next several hours, as Robert fully awakened and his family was allowed to visit, I watched something extraordinary unfold. His recovery wasn't just faster than expected. It was faster than anything I had ever seen in cardiac surgery patients. His heart rhythm remained perfect. His surgical incision was healing at an accelerated rate. His energy levels, even hours after major surgery, were remarkable. By evening, he was sitting up in bed, joking with his daughters and holding Maria's hand. But it was Maria who said something that stopped me in my tracks. "Doctor," she said, pulling me aside around 7 hours that evening, "I need to tell you something." During the surgery, around noontime, I was in the chapel. I don't know why, but I suddenly felt this overwhelming need to pray. Not just regular prayer, but like I was fighting for my husband's life. I felt a chill run down my spine. "What time exactly, Maria?" It was right at noon. I remember because the chapel bells were chiming 12 hours. I prayed harder than I've ever prayed in my life. And then, maybe 20 minutes later, I felt this incredible peace. Like I knew everything was going to be okay. Noon. That was exactly when Robert's heart had stopped beating. And 20 minutes later, that was exactly when it had started again. I didn't tell Maria what had happened during those 17 minutes. I couldn't. How do you explain the medically impossible? How do you tell a woman that her husband had been clinically dead for nearly 18 minutes and then spontaneously returned to life? That night, I sat in my office staring at Robert's surgical report. I had to document what happened, but how do you write in a medical chart that a patient's heart stopped for 17 minutes and 38 seconds with no explanation, then restarted on its own with perfect function? I ended up writing, patient experienced 17 minutes of cardiac arrest during surgery. Heart rhythm spontaneously returned to normal sinus rhythm without intervention. No apparent neurological deficit. Surgery completed successfully. But those clinical words felt hollow, inadequate to capture what I had actually witnessed in OR3. You won't believe what happened next. 3 days later, I was making my usual rounds when I found Robert sitting in his hospital chair, fully dressed in street clothes, waiting for his discharge papers. This man, who had undergone major cardiac surgery and experienced 17 minutes of cardiac death, looked better than most people look after a good night's sleep. "Dr. Chen," he called out as I entered his room. "I was hoping to catch you before I left." I reviewed his chart quickly. Everything was perfect. His EKG showed a heart rhythm stronger than it had been before surgery. His blood work indicated healing that should have taken weeks, not days. His surgical incision looked like it was several weeks old instead of 3 days. "How are you feeling, Robert?" He stood up from his chair with an energy that defied everything I knew about post-surgical recovery. "Doc, I haven't felt this good in years. Maybe ever. It's like I got a brand new heart." Maria appeared from the bathroom, her face glowing with happiness. "Doctor, you have to see this," she said, pulling out her phone. "Show him, Roberto." Robert smiled sheepishly and walked to the center of the room. Then, to my absolute amazement, he began doing jumping jacks. Smooth, controlled, rhythmic jumping jacks. His heart monitor showed a perfect response to exercise, gradual increase in rate, then smooth return to baseline. "Robert, you shouldn't be—" "Doc, listen," he interrupted gently. "Something happened to me in that operating room. I don't remember the surgery, but I remember something else." I felt that familiar chill again. "What do you remember?" He sat back down and looked directly into my eyes. "I remember being in a place that wasn't the operating room. It was bright, but not with regular light. And I heard voices. Not yours, not the other doctors. Different voices. They told me it wasn't my time yet. They said Maria needed me, my daughters needed me, and that I had work left to do." Maria reached for his hand. "He's been different since the surgery, doctor. Not just physically. He's calmer, more focused. He says he knows now that everything happens for a reason." I wanted to dismiss this as typical post-anesthesia confusion or the psychological effects of surviving a serious surgery. But looking at Robert, seeing his remarkable recovery, feeling the profound change in his presence, I couldn't find a medical explanation for what I was witnessing. "Robert, during your surgery, there were some complications," I began carefully. "I know," he said simply. "I knew something happened. I could feel it. But I also knew I was going to be okay." After Robert was discharged, I found myself unable to focus on my other patients. I kept replaying those 17 minutes in my mind, searching for some rational explanation I had missed. I consulted cardiology textbooks, searched medical databases, even reached out to colleagues at other hospitals. The responses were consistent. What I described was medically impossible. Hearts don't restart spontaneously after 17 minutes of asystole. Patients don't recover neurologically intact after prolonged cardiac arrest. Surgical healing doesn't accelerate the way Robert's had. Every aspect of his case defied medical science. A week later, I was in the hospital cafeteria when Dr. Harrison sat down across from me. "I've been thinking about the Martinez case," he said without preamble. "So have I, every day." He leaned forward, lowering his voice. Michael, I've been doing cardiac surgery for 3 decades. I've seen things that push the boundaries of what we understand about human physiology. But what happened in OR3? That wasn't medicine. Then what was it? Dr. Harrison was quiet for a long moment, stirring his coffee absently. My grandmother used to tell me that God still performs miracles, but he usually does it through doctors and nurses and hospitals. She said we're his instruments. He looked up at me. But sometimes, maybe he works directly. I wanted to argue with him. My entire career had been built on scientific rationality, evidence-based medicine, logical cause and effect. But sitting there in that cafeteria, I couldn't find a single scientific argument to counter what he was suggesting. What do we do with that? I asked. We keep being doctors, he replied. But maybe we stay open to the possibility that sometimes medicine isn't enough. 2 weeks later, Robert returned for his follow-up appointment with the cardiologist. I wasn't officially part of that consultation, but I made sure to be in the cardiology department when his results came back. Dr. Patricia Santos, our head of cardiology, called me into her office with a puzzled expression on her face. Michael, I need you to explain something to me. This is Robert Martinez's echocardiogram from 2 weeks post-surgery. She pulled up the images on her computer screen. Robert's heart looked perfect. Not just repaired, perfect. The damaged tissue that had necessitated surgery was completely normal. His ejection fraction, which measures how effectively the heart pumps blood, was better than average for a healthy 25-year-old. This can't be the same patient, Dr. Santos said. Compare it to his pre-surgical echo. The difference was startling. The weakened, damaged heart muscle visible in the earlier images had been completely restored. It was as if Robert had received a heart transplant from a perfect donor. Patricia, this is definitely the same patient. Then explain to me how cardiac tissue regenerates itself in 2 weeks. Explain to me how damaged heart muscle becomes better than normal. This violates everything we understand about cardiac pathophysiology. I looked at the images again, at the impossible perfection of Robert's restored heart. I can't explain it. That afternoon, I found myself in the hospital chapel for the first time in my career. I'm not sure what I was looking for there. Answers, maybe. Or just a quiet place to think about everything that had happened. The chapel was empty except for an elderly woman in the front row, praying quietly. I sat in the back, staring at the simple cross on the wall, trying to make sense of Robert's case. After a few minutes, the woman turned around and noticed me. "You look troubled, son," she said kindly. "Just trying to understand something that doesn't make medical sense," I replied. She smiled gently. "Sometimes the most important things don't make sense to our minds. They only make sense to our hearts." As I sat there in that quiet space, I thought about my 12 years of practicing medicine. I thought about all the patients I had guided through surgery, all the families I had comforted, all the times I had relied on science and knowledge and experience to make life or death decisions. I had always believed that medicine was about understanding and controlling the human body through scientific principles. But Robert's case suggested something different, that sometimes life operates according to principles that transcend science. That evening, I went home and called my father, a retired family doctor who had practiced medicine for 40 years in a small town in Iowa. "Dad, let me ask you something. In all your years of practice, did you ever see something that couldn't be explained medically?" He was quiet for a moment. "Son, why are you asking?" I told him about Robert's case, about the 17 minutes of cardiac arrest, about the impossible recovery. I told him about my struggle to reconcile what I had witnessed with everything I had learned about medicine. When I finished, my father sighed deeply. "Michael, let me tell you about Mrs. Henderson." He went on to describe a case from his early career, a patient with terminal cancer who had been given weeks to live, but who recovered completely after her entire church congregation prayed for her healing over the course of a single night. "The oncologist couldn't explain it," my father continued. "The pathologist couldn't explain it. The tumor was just gone. No trace of cancer cells, no evidence it had ever been there." "What did you do with that information, Dad?" "I kept being a doctor," he said simply. But I also learned that medicine isn't the only force at work in healing. Sometimes we're privileged to witness something greater than our understanding. A month after Robert's surgery, I received a letter addressed to me at the hospital. Inside was a photograph of Robert and Maria at their daughter's graduation ceremony, the same graduation he'd been afraid he would never see. Robert looked vibrant and healthy, his arm around Maria's shoulders, both of them beaming with joy. On the back of the photograph, someone had written, "Dr. Chen, thank you for being God's instrument. We will never forget what happened in that operating room." But it was the letter inside that really affected me. "Dear Dr. Chen, I know you probably don't believe what I'm about to tell you, but I need to share this with someone, and you're the only person who might understand. During my surgery, when my heart stopped, I wasn't unconscious like you probably think. I was somewhere else. I was in a place filled with the most beautiful light I've ever seen, and I heard voices telling me that it wasn't my time yet. But here's what I really need you to know. I saw you in that place too. You were standing next to my hospital bed, but you looked different. Younger somehow. And there was light around you too. You were arguing with someone I couldn't see, insisting that I needed to go back, that my family needed me. I don't know if you remember that, or if it was just something my mind created, but I wanted you to know that whatever happened in that operating room, you didn't just use medicine to save my life. You fought for my life in a way that went beyond medicine. Thank you for not giving up on me during those 17 minutes. I stared at that letter for what felt like hours, reading it over and over again. Robert described seeing me in that otherworldly place, arguing for his life. The rational part of my mind wanted to dismiss it as hallucination, as the brain's attempt to create meaning from trauma. But something deep inside me remembered. I remembered standing in that operating room at exactly 11 hours and 32 minutes, watching Robert's heart monitor flatline, and feeling something I had never experienced before. It wasn't panic or professional concern. It was a fierce, almost desperate determination that went beyond medical protocol. I remembered thinking, with an intensity that surprised me, this man is not dying today. Not on my watch. Not when his daughters need him to see them graduate. I had thought those were just my own professional thoughts, my natural response to losing a patient. But now, reading Robert's letter, I wondered if something more had been happening in that moment. The next few months brought a series of cases that further challenged everything I thought I knew about medicine. Not all of them were as dramatic as Robert's, but each one carried elements that couldn't be fully explained by medical science alone. There was 8-year-old Emma Thompson who came in for emergency appendix surgery. Her appendix had ruptured, and by all medical indicators, she should have developed life-threatening sepsis. But during surgery, when we opened her abdomen, we found that her body had somehow contained the infection perfectly. The rupture had sealed itself, and her abdominal cavity was completely clean. Her mother later told me that their entire extended family had been praying continuously from the moment Emma complained of stomach pain. "We formed a prayer circle right there in the waiting room," she said. "About 30 of us, holding hands and praying for our baby girl." The surgery that should have taken 3 hours was completed in 45 minutes. Emma recovered faster than any pediatric appendectomy patient I had ever seen. Then there was Margaret Chen, no relation to me, despite sharing the same last name, a 78-year-old grandmother who came in for emergency gallbladder surgery. Margaret's case was complicated by severe heart disease and diabetes. Her surgical risk was so high that 3 different surgeons had initially refused to operate. But Margaret's condition was deteriorating rapidly, and Dr. Harrison finally agreed to attempt the procedure, knowing it might be our only chance to save her life. During surgery, Margaret's blood sugar levels began fluctuating wildly, something that can be fatal during anesthesia. I was struggling to maintain stable glucose levels when suddenly, inexplicably, her numbers stabilized perfectly and remained steady for the duration of the procedure. After surgery, Margaret told me something that sent chills down my spine. "Doctor, I need to tell you about my dream during surgery," she said. "I dreamed I was in my childhood kitchen with my grandmother, who passed away 20 years ago. She was making her famous apple pie, and she told me that she had asked God to help stabilize my blood sugar during the operation." I checked Margaret's surgical records. Her blood sugar had stabilized at the exact time she described being in that kitchen with her grandmother. These cases began to accumulate, each one adding another layer to my evolving understanding of medicine and healing. I started keeping a private journal, documenting not just the medical details but also the unexplainable elements, the perfect timing, the impossible recoveries, the stories families told me about prayers and dreams, and unexplained peace during their loved ones' surgeries. 6 months after Robert's case, I was asked to speak at a medical conference about unusual cardiac events during surgery. I had planned to present Robert's case in purely clinical terms, focusing on the medical anomalies without mentioning the aspects that defied scientific explanation. But standing at that podium, looking out at 200 fellow physicians, I found myself telling the complete story. I described the 17 minutes of cardiac arrest, the spontaneous return of perfect heart rhythm, the accelerated healing, Robert's remarkable recovery. I shared the timeline that coincided with Maria's prayers in the chapel. I even mentioned Robert's letter describing his experience during those 17 minutes. The response was unlike anything I had expected. After my presentation, nearly a dozen physicians approached me privately. Each one had their own story, cases that had challenged their understanding of medicine, recoveries that couldn't be explained, moments during surgery when something beyond their training had seemed to guide their hands. Dr. Jennifer Walsh, an orthopedic surgeon from Boston, told me about a patient whose shattered spine had healed in ways that violated everything she knew about bone regeneration. Dr. Yesaris. Marcus Johnson, an oncologist from Atlanta, described a patient whose terminal brain tumor had simply vanished between one MRI and the next, with no medical intervention. Dr. Sarah Kim, a pediatric surgeon from Seattle, shared the story of a premature baby who survived despite conditions that should have been incompatible with life. Each story followed a similar pattern: medical impossibility, complete recovery, and families who described intense prayer or spiritual experiences during the critical moments. "We don't talk about these cases in medical journals," Dr. Walsh said quietly. "How do you publish a paper titled Unexplained Healing when medicine isn't enough?" That conversation led to the formation of what we informally called the Unexplained Recovery Group, a small network of physicians who began documenting and sharing cases that challenged conventional medical understanding. We weren't abandoning science. We weren't becoming faith healers or abandoning evidence-based medicine. We were simply acknowledging that sometimes healing occurs through mechanisms we don't yet understand. A year after Robert's surgery, I found myself back in the hospital chapel, this time not seeking answers, but simply reflecting on how much my perspective had changed. The same elderly woman I had met there months earlier was in her usual spot in the front pew. She turned around and recognized me. "You look more peaceful now, son," she said with a warm smile. "I think I am," I replied. "I've learned that not everything has to make sense to be true." She nodded approvingly. "That's wisdom, dear. The most important truths are often the ones that can't be measured or explained." As I sat there in the quiet of that chapel, I thought about Robert Martinez, who was now living a completely normal life with a perfectly healthy heart. I thought about Emma Thompson, who had grown 3 inches since her miraculous appendix surgery and was now the star pitcher on her little league team. I thought about Margaret Chen, whose diabetes had remained perfectly controlled ever since her gallbladder surgery. I thought about all the families who had sat in waiting rooms, holding hands and praying for their loved ones, somehow participating in healing in ways that medical science couldn't measure but couldn't deny. 2 years after that transformative day in OR3, I received another letter from Robert Martinez. This time, it was an invitation to his daughter's wedding. "Dr. Chen," the letter read, "you helped make sure I would be here to walk my daughter down the aisle. We would be honored if you would join our celebration." I attended that wedding, and I watched Robert dance with his daughter, his heart strong and steady, his life full of the moments he had almost missed. During the reception, Maria pulled me aside. "Dr. Chen, I need to tell you something. Ever since Robert's surgery, our whole family has been different. We pray together now. We volunteer at the hospital. We visit other families who are going through what we went through." She paused, looking across the dance floor at her husband spinning their daughter around. "I think what happened in that operating room wasn't just about saving Robert's life. I think it was about showing all of us, you included, that there are forces at work in healing that go beyond medicine. And maybe that's exactly what our world needs to remember." 3 years after Robert's case, I was promoted to chief of anesthesiology at our hospital. In my acceptance speech, I said something that would have surprised the doctor I had been before that March morning in OR3. Medicine is both an art and a science, but perhaps most importantly, it's an act of faith. Faith in our training, faith in our colleagues, and sometimes, faith in forces beyond our understanding. Our job is to be excellent physicians while remaining humble enough to recognize that healing doesn't always follow the textbooks. Today, I still practice anesthesiology with the same scientific rigor and professional standards I always have. I still rely on evidence-based protocols, careful monitoring, and precise medication management. I still trust in the power of medical science to heal and save lives. But I also keep Robert's photograph on my desk, the one from his daughter's graduation. And sometimes, when I'm preparing for a particularly challenging case, I find myself saying a quiet prayer before entering the operating room. Not because I've abandoned science, but because I've learned that science and faith don't have to be enemies. Sometimes they work together in ways we're only beginning to understand. Robert Martinez taught me that healing is bigger than medicine, that life is stronger than death, and that sometimes the most important question isn't, how did this happen? But, what am I supposed to learn from this? He taught me that 17 minutes of impossible can change not just a patient's life, but a doctor's understanding of what it truly means to heal. And that's a lesson that goes far beyond anything they taught us in medical school. 5 years have passed since that transformative morning in OR3, and Robert Martinez continues to live with a heart that functions better than most people half his age. His cardiologist calls it medically inexplicable. I call it a reminder that medicine, for all its advances, still encounters mysteries that humble us. Last month, I ran into Robert at a coffee shop downtown. He was there with his grandson, his daughter's first child, born healthy and strong 2 years after the wedding I attended. "Dr. Chen," he called out, standing up immediately to embrace me. At 57 now, he moved with the energy and vitality of someone decades younger. "How are you feeling, Robert?" He smiled that same peaceful smile I'd first noticed when he woke up from surgery 5 years earlier. "Doc, every morning when I wake up, I remember that I shouldn't be here. And every morning, I choose to be grateful for whatever force decided I should stay." As I watched him play with his grandson, making the little boy laugh with silly faces and gentle tickles, I realized that Robert's miracle extended far beyond those 17 minutes of cardiac arrest. It rippled through his family, his community, and even through me, changing how I practice medicine and how I understand life itself. The unexplained recovery group I mentioned earlier has grown to include over 50 physicians from around the country. We meet quarterly, not to abandon scientific medicine, but to acknowledge its limitations and explore the spaces where healing transcends our current understanding. We've documented hundreds of cases now, recoveries that shouldn't have happened, healings that occurred faster than medical science predicts, patients who survived conditions that should have been fatal. Each case is thoroughly investigated, carefully documented, and honestly reported. What we've discovered is that these impossible recoveries often share common elements: families and communities united in hope, patients who maintain faith despite dire prognoses, and medical teams who refuse to give up even when textbooks suggest they should. We're not suggesting that prayer replaces medicine, or that faith eliminates the need for proper medical care. What we're acknowledging is that healing sometimes occurs through mechanisms we don't yet understand, and that the best physicians remain open to possibilities beyond their training. Recently, a young resident asked me how I reconcile my scientific training with my belief in unexplained healing. I told him about Robert Martinez and those 17 minutes that changed my understanding of medicine forever. Medicine, I explained, is about using everything we know to help our patients heal. But wisdom is recognizing that we don't know everything yet. The best doctors I know combine excellent technical skills with humility about the mysteries that remain. I still encounter cases that challenge my understanding. Last week, I worked with a patient whose recovery defied every prediction we made. Her family had traveled from 3 different states to pray together during her surgery. When she woke up, her condition had improved beyond anything we had hoped for. I documented the medical facts carefully and accurately, but I also noted in her chart something I never would have written 5 years ago. Patient's recovery exceeded all medical expectations, Contributing factors may include excellent surgical technique, optimal anesthetic management, and immeasurable family support. That phrase, immeasurable family support, has become my way of acknowledging forces that can't be quantified, but can't be ignored. Every day in my practice, I see the intersection of science and something greater. I see families whose love creates healing environments that enhance medical treatment. I see patients whose hope and faith contribute to recoveries that surprise their doctors. I see medical teams whose dedication goes beyond professional duty into the realm of calling. Robert Martinez taught me that the question isn't whether miracles happen, it's whether we're humble enough to recognize them when they do. He showed me that 17 minutes of medical impossibility can teach us more about healing than 17 years of textbook study. As I finish writing this, I can hear the familiar sounds of the hospital around me. Monitors beeping, conversations between staff, families gathering in waiting rooms with hope and fear intermingled in their hearts. Tomorrow, I'll guide another patient through surgery, using all the scientific knowledge and technical skills I've acquired over my career. I'll monitor their vital signs with precision, adjust medications with expertise, and follow protocols built on decades of medical research. But I'll also remember that sometimes, healing requires more than medicine. Sometimes, it requires the kind of faith that Maria Martinez showed when she prayed in that chapel. The kind of determination Robert's heart showed when it decided to beat again after 17 minutes of silence. And the kind of humility that allows doctors to admit when something beyond their understanding has taken place. Some things belong not only to science, but to life and faith. If this story touched you, subscribe, and tell me where you're watching from. You're not alone in believing that healing sometimes transcends our understanding, and that the most important recoveries often can't be measured by medical instruments alone. They can only be measured by the lives that are transformed, the families that are reunited, and the reminder that in our complex technological world, mystery and wonder still have a place in the practice of medicine. Share your own experiences in the comments below. I believe that stories like Robert's happen more often than we acknowledge, and that sharing them helps us all remember the profound responsibility and privilege of participating in the healing of human lives.